Well, that's the update. I remember yesterday when we had this conversation, we're all pretty disappointed about what's going on, what's happening, how did this happen? Well, we're seeing swift action, which is a good thing. And according to that report, 4 doctors, 2 nurses, and others are undergoing investigation over that viral video. But we need to have a conversation about how this actually works so we can see how this can stop. We don't want this to be happening. It's not the first, second, third, fourth, or fifth time that we've had this sort of situations. What sort of training do these staff need to understand when it comes to gun victims? Is there something that they are worried about that we don't quite understand? We have with us in the studio the Chairman House Committee on Health, Mr. Amos Magaji. Thanks so much for being with us on the program.
Thank you for having me.
Good morning.
Good morning.
Yeah. All right, so let's get down to it. When you saw this situation at the FMC in Jabi, what was the thought that came to your mind?
Well, a friend of mine, Mike Ozigi, I just opened my WhatsApp and I saw a video. And typical of him, he doesn't really always send, video clips to me. So I look at it and then I saw what happened. I said, wow. So immediately I sent the video to the medical director, Professor Sahad. And then I got a response almost immediately from him that we are investigating the matter and then that is not our character. So that same night, I took a visit to the emergency.
Okay.
They didn't know who I was. I went on jeans and T-shirts, and I just went there looking for somebody. I said, okay. And I, to see how they are handling, patients and to get a first-hand information on that matter. So that is what I did. And since that time, we have been following up with the hospital, trying to see what really happened. And then, of course, as you saw in the clip, the hospital is currently investigating the matter. And we in the National Assembly will not only also sit down, we are also looking at the provision of the law. We are also looking at possibility of holding a public hearing.
A public hearing on this?
Yeah.
Just so people can understand how the gunshot victims thing works?
There is a law right now that any hospital, sometimes we are grateful for this kind of feedback. I can assure you that the Federal Medical Center, Jabi, is one of the best hospital, in FCT. But once in a while, we have some of these issues. But then we can't relax and say they are doing well. We have to make sure that every day we improve on service delivery. The life of human beings are very important. A little mistake can cost life. So, but when it comes to gunshot victims, there is law that anyone that is injured, treat the person first and then alert the police. You don't reject, a patient that comes to the hospital. The first duty of a doctor or a health care provider is to save lives. Whether the person is an armed robber, whether he is a bandit, save life first, then further investigation can commence.
So why do we have cases, if this is so clearly stipulated, why do we have so many cases when people come to the hospital with gunshot wounds? We always find that the health professionals that meet them first usually are very hesitant to handle those cases. Is there something about it that we don't know?
Yeah, previously there have been a lot of litigation, a lot of, even, let's not even look at the hospital. Are Nigerians really reporting incidences when they find it on the street? Sometimes because of the law enforcement agent. You report a matter or something happened, you'll be dragged every day to the police station, or you are called here and there, so it distracts you from your work. That's why many of them will rather prefer let a law enforcement agent is there before they commence treatment. But right now, the best practice is that commence treatment and alert the law enforcement agent. So
I want to be able to, I don't want to lose that thought process.
Yeah.
So many hospitals, many healthcare professionals would prefer that law enforcement is present.
Yeah, that was before.
When there's a person with a gunshot, when they prefer for the law enforcement to be present before they commence treatment.
Yeah.
Why is that so?
No, because of the litigation.
What litigation?
Because most times they will say, okay, this is an armed robber and so on. Because many, many care workers have been dragged to hospital, have been dragged to court, dragged to police station and so on.
Just so they can give evidence, right?
Yeah,
they didn't commit any crimes.
Yeah. But of course, you know,
they don't like the inconvenience of
sometimes
going to court and police stations.
Too much.
Okay.
Yeah, but right now it is clearly stated. If anybody refuses, there is actually against the law, and you can be sued for it, you can be fined for it, you can be jailed for it. So Nigerians need to know that, and then if anybody, any health institution rejects an injured person, you have the right to sue the institution.
So based on the law right now, any health professional who turns around, turns back, or is reluctant to treat someone who comes to the hospital with a gunshot wound can be jailed for that?
They can be jailed.
They know this?
They know this.
But they're still... Or is it that maybe the information hasn't gone everywhere? Maybe many of them don't know.
It's not, sometimes it's not the information. There are times that the capacity, the holding capacity is very small. Like
holding capacity for injured victims?
Yeah, for injured victims.
Okay.
Sometimes you go to a hospital, maybe in accident, emergency, and it's as if that day all hell has broken loose. And then as you are there, like when I got to the hospital on, that was on Friday or on Saturday, right at the gate, I saw them bring in another patient, and then there was a little commotion, and I addressed it immediately, and I moved. So sometimes the health workers, based on the number of doctors that are there or nurses that are there are times that you bring maybe a bus was involved in an accident, and you have more than 30 people that are brought to the hospital. And if they are attending to those ones, and then another set of injured patients are coming. So you discover that sometimes the hospital will say, please go to the next hospital. But of course, the relatives or the friends of the injured person will not want to hear, because you want to save time, life, and in saving life, time is important. If you discover that your hands are full with emergency situation, the best thing is to refer them, okay, maybe try the next hospital, than to keep them for, if they are kept for 20 minutes, 10 minutes without being attended to, it's another problem. Are we getting what I'm saying?
I understand what you mean. But for a health professional who's a little reluctant to handle someone who's been in an accident or someone who has a gunshot wound, I can actually see it playing out where they'll dilly-dally for 10 minutes, 15 minutes, and they make
honestly,
you uncomfortable.
I watched that video and I wasn't happy. You know, I don't want to say anything yet because investigation is going on. But one thing clear we need to understand is that nobody goes to work and drop his heart at home. The health workers are also human beings. You don't know what she has been through, either family-wise or personally. But then any health worker has been trained to make sure that in situation of emergency, there is a required temperament to have when you are working in emergency and some required treatment. You don't treat cases in emergency as if you are in the ward. That's why they call it accident and emergency. And at that time, every second is important. The way they were walking, I even talked to the MD. I said, I'm not happy the way they moved the patient from the car. I believe you must have watched the video. Indeed. So I actually punctured many of their services. Personally, I spoke with the medical director there, and he himself accepted that there were errors in some of the processes. And then they are really, really investigating it. And of course, we are grateful for, those feedbacks, because feedbacks like this, help to strengthen the system. And I know it's not only Federal Medical Center, Jabi. If there are other hospitals that are,
We've heard this situation so many, especially in the Nations Cup. We've heard it so many times.
Yeah.
So many times. It's actually becoming a little, people are sending us messages on questions to ask you. Someone said I should ask you about the attitude of the lady in the viral video, the health worker. The lady, of course, who you were talking about. But you have addressed that. There's a temperament that comes with handling emergencies. And in many cases, for those of us who saw that video, you felt like that temperament wasn't there.
No, it wasn't there.
The public hearing, what's it going to be about? What's it going to cover?
We're going to invite many of the health workers.
Okay.
And then, of course, sometimes the video is there. We're going to invite, you know, when it comes to public hearing, it's an open hearing. So any Nigerian civil society organization will come and let them also air their view. Perhaps there are other things we have not heard, or there are things that we've not seen before. This will, you know, create more light, and it will help us to maybe formulate laws or policy again. If there are gaps in the ones we have before, it will help us to sit up. And then, you know, sometimes laws are made, laws can be reactive, laws can also be proactive, depending on the situation. Like what is happening right now, we have to take adequate steps to ensure that things like this don't happen, or the frequency of occurrence is reduced to the barest minimum.
Let's talk about the health sector in the nation's capital. You know, when it comes to gunshot victims and people from accidents, the capacity of the emergency centers that we have in the nation's capital, are they enough? Have we, because you see, you mentioned something there, and personally, I've had a terrible situation where we had to start wondering where to move a corpse because the capacity wasn't enough. We have that situation here in the nation's capital where it does feel like the health centers, FMC Abuja is not bad, the National Hospital is not bad. A lot of these hospitals are not bad in themselves, but their capacity to handle, because of the amount of, Abuja is transit, a lot of people move through here. So whenever things happen, whether they happen around the Kaduna Expressway or Kogi Expressway,
or even
Kefi,
yeah.
Nasrawa, whenever something, even in Benue sometimes, when these things happen, they bring all of them to the nation's capital because they believe that you get better healthcare services here. Is that the case?
Yeah, you see, that's the reason why we're also calling on the subnationals to make sure that the investment on health is not only done in the federal. And going by what we have seen these few days, let me also put a call on the, plead with the you know, FCT minister to allocate land to Federal Medical Center Jabi. I have actually moved a motion on that because you see, Federal Medical Center Jabi is expanding, but then the space they have is limited.
Yes.
Then just adjacent, you know, just by the side, there's an empty land where we requested that FCT minister should allocate that land to FMC Jabi. If that land is allocated, they can expand their accident and emergency. Maybe just take a walk and see the accident and emergency.
Because that's, I've been to FMC Jabi.
Good.
The accident and emergency section is towards the back. It's towards the, if you enter from the main entrance, the accident, it's on the, towards your one hand, it's towards the right. And I know that there's a winding there's a winding thing that you have to climb to get to the top, where a lot of those accident victims.
That is the probably ICU.
Yes, the ICU.
Yeah, but the accident emergency is just immediately you enter the gate.
Okay.
You see the OPD, and then you move to your left. You will see the accident and emergency.
Okay, yes. So but, is that the part that they want expanded?
Yeah, if they have the land by the side of the hospital, they can expand the hospital, build a bigger accident emergency that can carry the so many patients. Okay. Now another problem is Abuja is growing every day, and then even the hospitals in Abuja that we have known since, I've been in Abuja for almost more than 40 years, and I can tell you that many of the hospitals are still there, like the Garki Hospital. So even the FCT district hospitals need to be expanded and then well equipped so that the pressure on National Hospital, the pressure on FMC Jabi will reduce. If somebody has a good hospital in Karmo, for example, there is no need bringing a patient to FMC Jabi.
All right, well, that's where we're going to have to end our conversation. But I want to thank you very much for being with us on the program, and good luck with all the work you do.
Thank you.
We'll be following up on that public hearing, just so we can hear what is being said there. Mr. Amos Magaji, the Chairman, House Committee on Health, joining us to give us an update on the FMC Jabi situation. Thanks again.
Thank you very much.